So today I do integrative medicine. I've been doing this for a while. So we're going to talk about how to integrate nutritional and herbal supplements into your treatment journey. I have no relevant disclosures today. I think I'm one that only followed the instructions, Rusi, that I did do my know, show, and overcome. She asked us to share some questions here of like, how would I like, what I would like you to know about myself and ovarian cancer. Guess what? I'm celebrating my silver anniversary this year in gynecologic oncology. You never would guess that, right? I started when I was 3. I'm an early, Doogie Howser here. And I wanted Dr. Gershon to be here because he was the one that actually hired me into gynecologic oncology a long time ago. And how I show my short support for the community is I wear teal as often as I can throughout the year. I'm even wearing my Ovarcoming socks right now. And I wear them frequently to clinic. And Carmen, I will prove that to you. I will show you. And I just complimented her on her teal shoes the other day that I'm going to try and get. And how I challenge you to grow in gynecologic oncology awareness worldwide. Oops. I don't know what just happened. Let's go that way. It's to share your story and experience. I find that people learn more when it becomes personal and they remember things, and that will help them educate and share with others. And last but not least, hopefully, how do I overcome? My favorite show, Friends, watch it almost every night. I probably could tell you every episode, but one of my favorite expressions in the past year is pivot, because there's been a lot of changes, and I recommend we got to pivot and go a new direction. And how I overcome is cliffhanger. I don't know if this. There we go. Definitely having faith. One of the starting my career a long time ago when I was only 12, my grandfather told me, God never gives you crosses heavier than you can bear. And it's been my mantra for many, many decades now, that even at those difficult moments that we got to keep moving forward. I have amazing mentors like Dr. Gersonson, who just spoke to us, among many others throughout the Houston and actually even internationally, that really help give me guidance at those tough decision points. And then my family, which I'm sure you're going to hear me mention a child once or twice throughout this talk. So moving on to nutritional supplements. I get this asked a lot by my patients as, are they really medicine? Do I really need to report them? Do I need to talk about them? Supplements are naturally derived, and some people feel better about taking supplements than taking chemotherapy. Although I could tell you a good majority of our chemo agents are also derived from plants and trees. So they're natural. And just like those naturally products that you can see in those pictures, those are all plants that are sources for some of our common chemotherapy agents like paclitaxel, like etoposide, and then the list goes on. Nutritional supplements do have a lot of activity, and I've been researching them now here for a few decades, but we still have very limited data on the efficacy and safety, and we're going to hit some high points today. One of the things that I have found throughout my career is that, if we don't ask specifically, usually patients aren't really willing to share what supplements they're on because they don't think of them as medication. And then I'll go in and I'll talk to them and I'll come back, well, they're taking this and this and this and this. And I actually have a list of things that I recommend, which you're going to see here, for everyone to be taking. So I do encourage my healthcare colleagues out there to be very specific when you're asking, which supplements do you take? What protein do you take? And getting more information so that we know what we're dealing with. Even though there's many of us doing research in this arena, there's still very limited data available. And the data that is out there, a lot of it is from animal data. And we're going to talk about today about how not, Dr. Google does it really well, of telling you things are fact from animal data when it doesn't really extrapolate to humans. And we're going to talk about how to look at that data and when to ask why. So I just want to hit the high points of some drug and herbal nutritional supplement drug interactions that we do know of and why there may be a problem. So very often we get concerned, and where your healthcare team is coming from is, what if it interacts with the chemotherapy? Because the chemotherapy, we just have seen quite a few studies presented today. And that was just a really 20,000 foot view, but those are things we know are going to help, right? So where nutritional supplements can interfere with the metabolism, they may change the absorption or the uptake into the tumor itself, or into the body, not even allowing the drug to get there. And they can also expedite or increase the clearance of the drug. And then we also have seen a number of chemo agents and new supplements that actually interact. I think one of the big examples I always give my patients is carboplatin. I'm sure many of you in the room are very familiar with carboplatin. It's one of our backbones. How does it work in the body? Anybody? I won't call anybody out. It is it acts like a free radical to attack the DNA of the cancer cell. So yes, taking free radical scavengers like antioxidants will immediately and directly interact with your carboplatin. So that's why I'm always like, no high dose. Now you can take a multivitamin, that's fine. But the juicing during chemotherapy, high doses of antioxidants, vitamin C infusions will directly interact with carboplatin. So those are things that we try to discourage, and we're going to go through that data a little bit more. Black cohosh, which is a common phytoestrogen, can interact with doxorubicin and docetaxel metabolism. Glucosamine also methylfolate, and flaxseed oil can also decrease the absorption when you're on oral chemotherapy agents. So these are really important things that people think are, these are supplements, they're innocuous, there's no problem. There actually are problems, and we need to think about it. This is one that I think is really concerning, because we monitor your labs while you're on chemotherapy, and we may hold treatment, do dose reductions of the active chemotherapy if you're showing signs of liver toxicity. Your healthcare team doesn't know you're taking one of these supplements and that may be causing the liver toxicity, then you run into a problem. So I think milk thistle is one that is really popular out there in the internet world. I have a lot of patients that ask about it. What scares me about milk thistles is a lot of unpredictable hepatic failure. So yeah, I wouldn't want to take that risk while I'm trying to fight my cancer. So I discourage using that because it's underreported how often it causes liver failure, but it definitely, the number of case reports in the literature is concerning enough to red flag it, to say probably not while you're on chemotherapy. I generally don't recommend it even when you're off chemotherapy. And you can see even high concentrations of green tea can interact with chemotherapy as well and cause liver toxicity. The liver is one of the most important organs when it comes to your treatment, because it's how the drugs may be activated or cleared from the body. And so we need to kind of treat our liver kindly and make sure we're taking care of it and not adding extra burden while you're on treatment. Clotting is important during your treatment journey, not only during surgery, pre-op, post-op, but during chemotherapy, when you may not be as active as you were at one point, that increases your risk for clotting in general. So we definitely don't want to be on supplements that may increase your risk for clotting or bleeding, either way. So you're like, geez, Dr. Smith, when can I take supplements? I thought you were telling me about how to integrate it into therapy, right? So I do think that there are a lot of supplements, which we're going to go through, that can help with supportive care during chemotherapy, preventing neuropathy, which can be really a lifelong challenge if it occurs. Energy level, that's fatigue is one of the biggest challenges, because nobody has time to slow down. Very often, our patients are caregivers for other people in their family, or have very active jobs or in the community. So energy is important. Immunity is really important, because we don't want to get those infections that may put you in the hospital, cause a treatment delay, or put treatment on hold. Menopausal symptoms are really just very disruptive to our quality of life. So there are nutritional supplements to help with that. bone health, and then that muscle integrity, because you're going to want to be active again. And we're going to show you how chemotherapy can really expedite muscle breakdown. And even when you're off of chemotherapy in that survivorship mode, how to maintain good health for all the other care providers in here and caregivers. These are general advice for all people generally to help maintain good health, preventing recurrence, and then recovery from chemotherapy. So antioxidants, I mentioned it a little bit with carboplatinum, but I often hear antioxidants for cancer prevention. In general, for a patient who has no risk factors, and this is where there's a little caveat, because I do a lot of health and wellness education, is making sure you do not have pre-existing cancer before you start an antioxidant regimen. So making sure you've done your mammogram, making sure you've had your pap smear, pelvic exam, colonoscopy, for men, prostate exam. So it's all of those things, because there's a lot of data that it may be potentially harmful and actually be a pro-radical if you already have pre-existing or undiagnosed cancer. So there was a number of studies. This have been out for quite a while, but they're just not really well publicized. The ATBC trial was done in lung cancer patients who were, or not lung cancer patients, in smokers in the prevention of getting lung cancer, and actually showed that taking antioxidant beta carotene actually increased the risk of lung cancer by 18%. And then that was confirmed in the CARROT study that also looked at vitamin E and vitamin A, which I won't use the generic, I just realized who audience I'm talking to. Vitamin E and A actually also increased the risk of, for smokers to develop lung cancer by over 28%. So that was like, oh, wow. And then it was like, well, then they looked at a head and neck cancer population in the survivorship mode. Can these antioxidants help in recovery and survivorship? And they saw a significant increase in recurrence and secondary cancers in these patients who had just beat the battle with head and neck cancer. And then in prostate cancer, which is one of our larger male tumor type, they did a study to see whether or not they could prevent prostate cancer in patients with elevated PSAs, and actually demonstrated that the antioxidants increase the risk of developing prostate cancer in those patients who had elevated PSAs at baseline. So again, it's getting that baseline, making sure you truly have a clean bill of health. There's lots of studies that we don't have time to go through today that do show benefit of antioxidants in that arena. So it's making sure you truly have a clean bill of health, and that's the challenge. Phytoestrogens are really popular in our patient population for all the gynecologic cancers, because surgical menopause is horrible. I can't speak of that personally because I haven't gone through it, but I have watched some patients really be challenged. And so that's really where we dove into our research, because earlier in my career, the options to take hormone replacement was really controversial. And I would say maybe it still is. Today we're using actual true hormone replacement, a little bit safer based on our data. But then there's some tumor types that truly can't have hormones. So the phytoestrogens really were something that a lot of women reached for after the Women's Health Initiative study. But they do have some estrogenic activity. So this is way too much data for you to really get into the details, but want you to know there's over 17 different types of phytoestrogens. So when we talk about phytoestrogens, it's not just soy, and it's not just primrose oil. There are quite a few of them, and some of them have, I don't know if you can see in this first column, it shows whether they have preclinical data versus clinical efficacy. And you can see there's a lot of them that have no data whatsoever. Whether they have preclinical or clinical data, have no data supporting it. But then they may have safety data, which is always important as well. And we looked at all of these in our lab, and I'm just going to highlight and I had to use this Katie Ledecky dive because my daughter is a swimmer and she's going to be in the Olympics in 2028. She's 12 right now. So just next time I come back in 4 years, it'll be Jellic on there. But we're going to take a quick dive into some data because I know you guys are all hungry. But evening primrose is a very popular phytoestrogen. It is from a flower that blooms particularly May and June in the Northeast. Down here is probably blooming all the time. I didn't check the Houston flower for evening primrose, but it's basically in blooms only in the evening. And they extract from the seed of this plant essential fatty acids that have a GLA component, and it's typically dosed 1 to 3 grams daily. We went to look at this to see whether or not it truly binds to the 2 primary estrogen receptors, estrogen receptor alpha and estrogen receptor alpha beta. So one of the assumptions that you have to do when you start looking at these nutritional supplements is, okay, we'll assume 100% bioavailability. I can tell you that's very unlikely in the pharmacology world that any drug has 100% bioavailability, let alone a nutritional supplement. But it gives us the worst case scenario. And the dose is 1,000 to 3,000 milligrams. So then we estimate what is the highest, if you had 100% bioavailability, what's the highest concentration you could reach in the body based on your total body volume. And that's where you get your theoretical maximum concentration of 143 micrograms per mil. And then that goes up to the animal dosing. Then we dose them at 43 milligrams per kilogram. So this is an affinity assay. So it's showing you the binding of estradiol, which is the, our control, tamoxifen, which is an anti-estrogen, and then the evening primrose. And in vitro, the estrogen receptor binding assay indicates that evening primrose has a strong binding affinity for both ER alpha and ER beta. So if you're trying to avoid estrogenic activity in an estrogen-mediated tumor, evening primrose, probably not your best option. So we did see some benefits in the cell lines, but I really take that with a grain of salt, as I'm going to show you with the maca root. You kind of really can't extrapolate from cell lines. So we did take this into the next step of we don't think evening primrose has 100% bioavailability. It actually has fairly poor absorption. So it's unlikely to actually reach those concentrations to have estrogenic activity, but we really would need more confirmation before I would safely recommend that to someone who truly had an estrogen-mediated cancer. Another alternative is maca. Maca root is from the root of a tree that is native to South America and Peru. It has a lot of clinical data indications across the board for hormone-mediated conditions like fertility, but menopausal symptoms one is where it has the most actual formal clinical trials. And it's dosed at 900 milligrams to 1,000 milligrams because that's what's available here in the US twice a day. So when you look at the preclinical literature, and this is where you might find as you're searching in Dr. Google or PubMed, this study looked to investigate maca root on fertility in female mice, looking at increased fertility and weight, versus this study was looking to see if the maca root had any effect on menopausal symptoms such as bone integrity. And you can see it dosed at 4.3 kilograms per, daily. When you look at the equivalent doses to maca root, this study gave 70 grams per dose, which is 39 times more than you could physically consume, versus a 300 milligram, which is actually much less. So you kind of have to really dive into that animal data. Really, when we did our study, we looked at a dose of 32 milligrams per kilogram was really what was the clinically equivalent to our current clinical dosing. I only bring this up and point this out is to start to break down that data from animals. And I think I won't get on my soapbox today, but the whole sugar causes cancer. If you look at that animal data, you'd have to fill this whole room with sugar and eat that all day, every day to be equivalent to what they're giving the mice in those studies. So I'm saying it's physically impossible to eat an equivalent amount of dose. Does obesity cause cancer? 1000%, because of silent inflammation pathways. So if you eat too much sugar, you're likely to become obese unless you're like a marathon runner. But even if you're not, like if you're eating too much, I'm saying you can have your dessert, moderation, moderation, moderation. But there was just a study, big news this week in sucralose, the artificial sweetener causes cancer. It's the same story. Quantity of dosing in animals is not equivalent to humans. So moderation, don't live on it, but you certainly can safely consume it. So I've told you all about what doesn't work. So what can you take is where we would, we want to say, you know, is there a supplement? This is a AHCC, which is a mushroom from the root of the mycelium. Main component of AHCC is an alpha acylated glucan. This supplement, I have done a lot of research in the HPV arena and shown its immunomodulatory benefits, but it's also the reason I initially got interested in HCC was the benefits with chemotherapy. It can help improve the side effect profile by boosting your immunity and helping quality of life. But we also have shown in our lab a lot of mechanism directly involving the NK pathway as well as interferon gamma. You know, Dr. Coleman laughed one time. He's like, you were on to the immunotherapy in helping with cancer control well before the rest of us. I was doing these studies like early 2000s and showing that HCC with chemotherapy had multiple benefits, and it's probably more of its immune modulation benefits versus these other direct mechanisms. And I'm going to expedite through here because we're running out of time, but we basically looked at this in combination with chemotherapy to show its safety. We were able to show and demonstrate safety with liposomal doxorubicin as well as paclitaxel. In these columns, the combination is that yellow bar, and you can see that's where we had the most tumor growth decrease, even more than the green bar, which is Doxil alone, and that was statistically significant, as well as showing downregulating of the apoptosis pathway helped confirm our mechanism of action. And we confirmed that with flow cytometry. We also have seen a lot of additive benefits with paclitaxel as well as the platinum agents with HCC. So it's a safe supplement and has studies worldwide, over 700 clinical studies, most in Japan because that's where the supplement is was discovered and is manufactured. But the data is really impressive. But what other supplements can you take safely during chemotherapy? This slide is a good nutritional foundation, not only for the patients in the room, the caregivers, the survivors, healthcare providers. This is a general recommendation I recommend for everybody, a multivitamin. Even though we all think we eat well, I can guarantee today's 2025 vegetables are not as great as the vegetables back in 1950 due to all the pollution in our soil, et cetera. So just good idea to take a multivitamin. Calcium, especially for patients going through chemotherapy, gets sucked out of your bones. Patients who have decreasing hormone levels, and that applies to men and women. Definitely the calcium does help. Omega-3s, I could give a whole like 3-hour lecture on the benefits of omega-3s, but beneficial head to toe, definitely during chemotherapy to prevent neurotoxicity. It can help with hot flashes. We do recommend to help boost immune system, and it can even help with weight loss by decreasing the silent inflammation pathway. Probiotics also work really well with omega-3s and weight loss, boosting immunity and general GI health. Fiber is another really good supplement for those menopausal symptoms because daily fiber supplement will help with consistency in estrogen reabsorption. And so that will help in controlling those menopausal symptoms. Vitamin B6 is helpful for neurotoxicity and energy. And then you can see some others here on here. The other last one I just really want to emphasize before I sit down is the protein supplementation, because muscle loss during chemotherapy and rebuilding that muscle during survivorship is really important, where you really need to be hitting closer to 100 grams per day, not like because you're in that healing mode, which is a lot higher than the normal like 1.2 grams per kilogram. So in conclusion, I do encourage, if you want to take nutritional supplements or herbal supplements with your chemotherapy, to ask your healthcare team, ask questions, and listen to their advice, because we're not just saying no sometimes to be negative or say, oh, they don't work. It's because of the safety data that I just like sped through for you. And communication is really important, because you're not winning by just saying, oh, I always won't tell them I'm taking it, because that's where that liver toxicity can pop up, renal toxicity pops up, and we think it's from the chemo, and it's really from something else that you're taking. So communication, we're all in this together. So thank you.